Welcome to the Realtor Who Wines podcast. I'm Rashelle Newmyer, your hostess with the mostest, a student of life, a connector, a passionate wine enthusiast, and your local favorite guide. Join me as we explore the vibrant Pacific Northwest, savor the finest wines, and champion the spirit of entrepreneurship. Each episode, I'll sit down with inspiring guests, supporting business ownership, and uncovering the stories that make this community unique. So grab a glass of wine, settle in, and let's embark on a journey of discovery and connection together. Cheers! Hi, everyone. Welcome back to the Realtor Who Wines. I'm Rashelle Newmyer, your Realtor Who Wines, and today I'm with Stacy. Cheers, Stacy.
Cheers.
Thank you for having us. Today we are in Stacy's beautiful office, but will you go ahead and introduce yourself to everybody?
Yes. Hi, everyone. My name is Stacy Marie Ronquillo, and I am a double board certified family and acute nurse practitioner. I am the founder of Remedy Functional Medicine, based here in Portland, Oregon. We serve several states, including Oregon, Washington, and Nevada. Hopefully soon California. But what my practice is we focus on perimenopause, menopause, hormone optimization, gut health, autoimmune diseases, and really filling in the gaps that conventional medicine just doesn't address.
Yeah, I love that. What led you, I know your background, but obviously the listeners don't. What kind of led you down this path to having your own practice?
Yes. Okay. This is a long story, but where do I begin? I've been in healthcare since I was 16 or 17 years old. I started volunteering, it's like, I want to go into medicine.
Yeah.
And I decided to go into nursing. But to get there took a while. I was a phlebotomist. I was a in-hospital vampire for 6 years. So I was that person who would, if you were in the hospital, you were woken up by me at 4:30, 5 o'clock in the morning.
Yeah. So everyone loved you.
Yes. I was the favorite of the morning, drawing blood. And then I got into nursing school, was working in the ER as a phlebotomist and also as an ER nurse. And I think over time, it was just, I still love emergency medicine. I love the adrenaline. I am an adrenaline junkie. But at the same time, I just saw more and more that we just keep putting Band-Aids on a lot of things.
Yeah, instead of getting to the root.
Yeah. Emergency medicine is great when you're having a heart attack, when you're having a stroke, when you break a leg, but it's not just, hey, here's a prescription and I'll see you next year, or follow up with your primary care doctor.
Yeah.
And when I started nursing school at UCLA, right before I started, my dad was diagnosed with stage 4 maxillary sinus cancer.
Oh gosh.
And so it was a journey, managing his diagnosis, going to nursing school, learning about all these things where I'm like, oh my gosh. And navigating the healthcare system was
Painful.
very painful.
Yeah.
Not just as a nurse, but also seeing the other side, calling for doctor's appointments, managing insurance. It's a full-time job. People don't realize it.
And you're already just so stressed because you're worried about your loved one, and then adding all that extra stress on top of it. Crazy.
The amount of hours, days we'd spend on the phone trying to get insurance coverage or trying to find the right referral. Yeah. My dad would go down rabbit holes with Dr. Google.
Oh, sure.
But
maybe it's this.
Yeah, exactly. But it's just, you can see how confused and desperate people get navigating the healthcare system.
Absolutely.
And then COVID hit.
Yeah.
COVID hit, and working in the ER just highlighted all the gaps in healthcare that we already knew about.
Sure.
But it just obviously.
Yeah. It made it very obvious.
Yes. Yeah. And very, very worse.
And public.
Yeah. I mean, the wait times when I was a baby nurse in the ED, wait times were like maybe 3-4 hours. And after COVID, it was normal to be waiting in the waiting room for 8-12 hours.
Oh my gosh, that's nuts.
And, you just see how many people, how many women as well, just get dismissed. Like, oh, you're just 40 something, you're 35.
You're just being hormonal.
It's just anxiety. You
Yeah.
just have a lot on your plate.
Yeah.
And so I decided, okay, I'm going to go to nursing NP school and figure out what are we missing in emergency medicine. Did primary care for a little bit and just automatically realized like, no, this isn't it. It's still putting Band-Aids.
Yeah.
And then, you know, I couldn't find a clinic or a place I could practice the type of medicine that I wanted. There's not a lot of clinics out there that can focus on relationships with their provider or their patients. I mean, when have you ever spent more than 7-10 minutes with your primary care provider?
Yeah.
Or
You're
OB-GYN?
actually like spend a lot more time with the nurses.
Exactly. Or just your medical assistant, which is great, but that doesn't give you that, you know, that closeness or relationship. And it just, a lot of patients don't feel like they're part of their care. It's just, oh, I got a prescription for this. This is what I have.
And I think that's also why a lot of people don't have a primary care doctor either. They just like make an appointment with whoever's on their insurance website or whatever.
Exactly.
And it changes every time because there isn't like a relationship built.
Yeah. And so I wanted to change that. I told myself, okay, I have all this background and I don't want to practice like that. And so it's like, I'm just going to build it myself. Let's do it. Let's try it.
I love that.
Yeah.
So then what led you, so you started doing that, but then what were like the first steps you took? Like, okay, I need an office or somewhere to practice out of. Like, we'll talk a little bit about that journey. When you finally made the decision, I'm going to open my own practice, what were the next steps after that?
It was a lot of Googling, a lot of talking to other providers who had their own clinics in different states, really getting over this imposter syndrome of like, can I do this? Like, you know, is this possible? But I knew in my heart with the way healthcare has been, it's just, there has to be something different.
Yeah.
And no one's going to do that for you if you don't make it.
Yeah.
So, lots of Googling. I got a business coach. I started delving into more and more education. Because I just didn't want to just open up a clinic. The more, even though I've been in healthcare for 18 years, the more I learn, the more I'm like, there's still so much I don't know. Like,
for sure.
It's crazy. And so it's also sort of a little bit of addiction.
Oh, yeah. Like, now what? Now what?
Yeah.
Yeah.
I need to know more about this and X, Y, Z.
Well, that's what makes you a trailblazer, because like you're paving this whole trail for others to come to, which is amazing. So talk about your, like, I don't want to say typical patient, but like your clients that meet with you. You mentioned perimenopause and menopause, but I know you also meet with gals in their like 20s that need to balance their hormones out and stuff. So who should reach out to you? Like, what kind of clients should be like, I need Stacy?
Yeah. So that is a very broad term, but in general, I would say any person who felt like there's just something off and I'm not getting answers.
Yeah.
You know, when a man or woman feels like, you know, my labs are okay, but I still feel like absolute crap.
Yeah.
Can I cuss on here?
Yeah, absolutely.
I feel like shit.
Yeah.
And, you know, they're not getting answers. You're just getting handed prescriptions. Or they know that something's off. They just don't feel like themselves. Those are my patients, whether it be a teenager who wants to learn about their menstrual cycle, because, you know, I don't know about you, but when I grew up, if you hit your teenage years and got a period, it's like, it's time for birth control.
Yeah.
Like,
totally.
It doesn't matter.
Well, and I actually got really bad migraines when I was a teenager. And like the first time I had a major migraine, I actually thought I was going blind. I like panicked. But I was like 14, but I got that like jigsaw vision that comes with migraines, but I'd never had a migraine before. So I was like, it's total drama queen. But I was like, is this it? I'm going blind. I'll be in a Lifetime movie soon, I'm sure. But a doctor is just like, oh, you just need to be on birth control. And then, of course, my parents are like, what? You know, because like they're like, she's 14. But I was just like, my head hurts. I don't know. But yeah, I was just put on birth control. I've been on birth control since I was 14, basically, which is a really long time.
Which isn't horrible.
Right.
However, the more I learn, the more I'm like, wow, had I known, maybe I didn't want to go on birth control, and there are other things that I could have done or addressed.
Sure.
Because now we're also seeing a lot of women there, early 30s, late 30s with infertility or undiagnosed PCOS.
Right.
But it's been masked this whole time because they've been on birth control.
Yeah.
So,
And then, so you'll talk to anybody as young as like a teenager about the menstrual cycle up to age.
Your 60s, 70s. Right now, my youngest patient is 6. And my oldest patient is 64.
What do you talk to the 6-year-old about?
That
their
specific,
parents?
specific patient has ADHD, some behavioral issues, focus attention issues.
Sure.
I'm working on diet, nutrition, and gut health.
Yeah,
So
for sure. Have you, so now, and knowing what you do now, and like, since you have a patient that's that young, and I have Rylan, and so like, have you noticed gut issues and stuff in kiddos, or like, because there's so much hormones in food now, like, what kind of impacts are you seeing on like young kids?
What don't I see? When it comes to children and teenagers, I think, gut health, but everything kind of starts with the gut. I mean, Hippocrates, I don't know if you've heard of that saying, all disease begins in the gut. Eczema, attention issues. I mean, there's so many children out there that now have eczema and food allergies. Like, there's something underlying going on here.
Yeah. So what kind of advice would you give parents out there that are listening of like, obviously we know what some foods, like certain drive-thrus and things like that, obviously have more hormones in it, but like to try and balance that out, like what's something else that you can do? Because like I'm a mom on the go, so the drive-thru is going to happen every now and then, but what is something else I could be doing to help counterbalance that a little bit?
I would say diversify the diet, lots of colorful foods and fiber. I can't stress enough how important fiber is, not only for a perimenopausal, menopausal woman, but also children, because the recommended amount is only about 7 grams of fiber, but for prevention and gut health, immune health, long-term longevity, we actually want more than 25 to 30 grams of fiber a day.
Oh my gosh, that's such a huge
difference.
difference.
Hard. It's so hard to do.
Yeah. Oh my gosh, that's a lot of fiber. What besides like a supplement or a powder, what are certain things that have a lot of fiber in it that people might not know?
Foods. Strawberries are great in fiber. Okay. Chia seed, avocados, corn tortillas.
Oh,
Surprisingly,
I'll get all my fiber.
Taco Tuesday. No, there's just so many options, but whole foods, vegetables, not just a salad.
Right. I know I have people in my life that like I always tease them that that's a salad soup because they put on like so much dressing and like totally defeats the purpose. You're like basically just drinking ranch. What are you doing?
I went through part of my journey, going through health and wellness was, doing the if it fits your macros kind of era where I told myself, I can eat anything. It's just as long as it fits a certain number. And you quickly realize when you do that sometimes a salad can be 1,200 calories when I could have just had a damn burger and fries for half the calories.
Right. When I was in college, I was a waitress at a restaurant, pretty large chain, and the salads were like some of the highest in fat and calories on the whole menu. And part of it was because it was like fried chicken with cheese, with blue cheese crumbles, with ranch, like, it all adds up. But it's so funny because people are like, I just had a salad. And you're like, ooh, you actually had like so much more if you would have just got a burger or whatever. What are some things that you've heard your clients talk about? Like, I just noticed this was off. And so they finally like talk to you. Like I know I have a friend right now that just got diagnosed because she kept asking questions and she kept going back. She's like, no, something's still wrong. Like stop just giving, like what you're talking about. Like they just kept trying to be like, well, try this prescription. And she's like, no, something's still. And finally they pinpointed an autoimmune. But what are normally like some early symptoms that like people should pay attention to or listen to their body to know to ask somebody like you more questions or to set up a consultation?
Ooh. I would say not only if they don't feel like themselves, if they don't feel like they're getting the attention or the education and thoroughness that they want with their providers, whether that be your PCP or OB-GYN, but also if you've got brain fog, irritability, mood swings, migraines are huge because migraines can absolutely be hormonal.
For sure.
Skin issues, eczema, acne, irritability, and inability to sleep. So that is the first thing that usually women over 35 start to complain about is like, I just can't sleep. I'm wired, but I'm tired and I can't turn my brain off.
Yeah. Well, and I think a lot of that all comes with the perimenopause, menopause stuff too. It's like all of a sudden your body's shifting and like all these things change. And then I think a lot of ladies out there just are like, oh, it's menopause. So they just like truck through, but don't actually seek any help or guidance through that. What would you say to those ladies that like just think like, oh, it's just part of menopause, I'll be fine, I'll walk it off kind of a thing, even though you can't?
I think the biggest tip for that would be just because you are symptomatic and maybe you don't want to do hormone replacement therapy or hormone optimization, it's much more than just brain fog. It's much more than just irritability. It's much, much more than just a hot flash or difficulty losing weight. It's so much more than that. Because if you address your hormones, optimize your hormones, you can prevent chronic disease like Alzheimer's, dementia, osteopenia. Like with my ER background, one of the biggest things that I want for my patients is to not end up in the ER in a hallway with no privacy waiting for days for an inpatient hospital bed, because that's how it is right now with healthcare.
Yeah. That's so true that like, I feel like as females, we've just been told to like tough it out with a lot of stuff, you know? And so I just feel like menopause has been one of those things. And I'm really happy to see that perimenopause and menopause has actually been a more talked about topic lately. I don't know if you've been noticing that too, but like when my family members that are older than me went through menopause, it was like a dirty word and you didn't talk about it. It was almost like postpartum. You don't talk about it. You just truck through and you handle that in private. And I feel like now the community of ladies are just like, no, we got to talk about this or we're all going crazy together. You know? And so I love that there's professionals like you that they can turn to and say, so like, not only am I talking about it, but like, now what? Help me. What am I supposed to be doing differently? And then also autoimmunes. I feel like those are becoming much more common. People are talking about it more. There's a lot more food options. What have you noticed about the autoimmune awareness coming out and like people getting diagnosed with autoimmunes more and more?
With autoimmune, it's very complex, but I will also say that women who are perimenopausal, postpartum, or, you know, menopausal get diagnosed with more autoimmune diseases during that time.
Oh, interesting.
And the fluctuations and loss of hormones in perimenopause and postpartum really influence that.
Okay. Yeah. See, you don't know what you don't know. And that's why you need to know somebody like Stacy. Talk about, so if I were to say, okay, Stacy, obviously I need you, what does that dynamic look like? Like you have a consultation, and I know that you do help people outside of Oregon, so I'm assuming that consultations via Zoom. Like talk a little bit about your client. Like experience.
For new patients who want to get started here with me at Remedy, you book a new patient visit. It's 90 minutes long. Like we go through everything together, and then we figure out what we need to do. I don't order labs until we go through your full medical history, because I'm not going to order anything just because I can. And because I serve several states, it's primarily telemedicine, especially since most of my patients are perimenopausal, menopausal. They've got full-time jobs, a house full of kids.
Yeah.
And so most of the time it is telemedicine. I do have some patients that are like, no, I really want to see you in person.
Yeah,
Stacey.
you're the reason to get out of the house.
Yes, exactly. So they come here to the clinic and we do all the things here. And then we kind of figure out what needs to be done and kind of go on a journey together.
And I know it's different because everybody's different, right? So like sometimes you'll have a consultation with somebody and then you come up with a plan where you meet like maybe once a quarter. And then you have other clients that you meet with multiple times a month. Like it just varies person by person, right?
Yes, absolutely. So most patients, I recommend that I see them consistently in a 6-month period because there's so many things to adjust and titrate, especially if we're starting a hormone optimization journey. It's not just here's a prescription and I'll see you next year or see you in 6 months. It's a lot of tweaking. So I like to see new patients at least every 6 to 8 weeks for the first 6 months. And after that, once you're like, oh, I got this, like I know what's going on, I understand what I'm doing and why. Then I see most patients who are on maintenance plans like once a quarter or at least every 6 months.
Nice. And then you have a new membership like relationship coming out. You want to talk about that a little bit?
Yeah. So this summer we just transitioned to a membership model to create more of a small clinic patient provider environment. So all new patients are encouraged to join a membership tier of their choice, whether that be seeing me one-on-one for 60 minutes every quarter, seeing me every other month, or seeing me monthly. It just depends what we're working on. And then we kind of go from there. I also offer my members sick visits like urgent care because I know all their history. So if they just need something quick, like a UTI or they've got a cold, then they can just pop in and be like, Stacy, can you help me?
Yeah. I don't want to go all the way to urgent care.
Or wait in that sick lobby.
And they just trust you to be able to help them with that. And so the membership, is that like a flat fee based on the tier that you're in?
Correct.
Okay.
Correct.
Yeah. And then labs and things like that are outside. I know one question you get asked a lot too is if you take insurance. Do you want to talk about that at all?
So unfortunately and fortunately, here at Remedy, we don't take insurance for visits. So, with an insurance model, insurance really dictates the care that we receive. So there's no way insurance would reimburse a 90-minute new patient visit, and all my follow-ups are 60 minutes. For the first 2 years, I was offering 30-minute visits, and out of all my patients, I've only had a handful book a 30-minute visit because they're like, no, this is my time. I want to learn everything. They want a 60-minute visit. So for the membership and for visits, we don't accept insurance. However, most labs can be run through insurance, especially if we're just monitoring things like hormone replacement therapy. I also accept FSA and HSA accounts. So if you're using like a health spending account, we can do that, and I provide superfills. So some patients also get reimbursed for the visits with their insurance with a superfill.
Okay. What has been something, just to transition a little bit on topics, because like you said, you like got a business coach and stuff, because like although you're running a clinic, like it is a business and a business model. What is something that you've learned as a business owner and like your journey with the clinic?
I think the biggest thing for me was really honing in on what I need as a patient. So, this is why I built my clinic, because I wanted to be the provider that I needed 5, 10, 15 years ago. And really honing in on that. Like, what would I want my provider to do for me? What kind of access would I want as a provider? And that's kind of built and helped me shape how I market and how I talk about my business. So while I do have a business coach, most of my marketing, it's all relative, because most of my patients come from referrals. Just like, oh my gosh, like, I get why it's quote unquote expensive. But people come.
That's so funny. The other day I was talking about you to a group of girlfriends, and that one of my friends was like, oh, I just actually heard of a different gal who's going to be at this event. And then she showed it to me. It was you. And I go, that is who I'm telling you about. So it was kind of funny that like somebody else had told her about you. And then I was telling her about you, because you do like events and panels and things like that, and like different workshops and stuff. Yeah. This is coming out in September, this episode. I know you have something going on in October. Do you want to talk about that?
Yeah. So, like I said, my background in emergency medicine and talking about filling in the gaps with healthcare and navigating healthcare. I really wanted to teach other clinicians how to do this. Yeah. And really bridge the gap between functional medicine and conventional care. And so I decided to start some courses. We've just had a few cohorts of clinicians go through the courses, and I'm doing another one in October. So That's awesome. You are a nurse practitioner, midwife, medical doctor, DO, ND, or even you're a nurse in the ER and you're like, I want to learn more about this stuff, but I don't know what to do. And where do I start? Where do I begin? What does this all mean? Yeah. Then the Filling in the Gaps course series is for you.
Yeah. And is that all digital or is that in person? So it's digital.
It's all via Zoom. They are recorded. I try to make functional medicine practical, sustainable, and effective. So none of this like woo-woo, like you're teaching clinicians to spend thousands and thousands of dollars on, testing. It's more about really honing in on the lowest hanging fruit and taking a different perspective on health. Yeah.
Well, one thing I've really always appreciated about you, I've seen you talk in large groups before, then one-on-one and stuff. And back to your marketing too, is that it's very approachable. Like, because again, we are taught like, oh, let's sturdy or don't talk about it. I love that like meeting with you is just like meeting with a girlfriend, but you're just like super smart and know all the things, but like never once is it like ever feel judgy or anything. You're like, no, the body's a body and this is like what's going on and things like that. So I can only imagine your teaching styles the same way, approachable.
Yes.
Yeah.
I mean, I can't tell you, like, I may use a lot of dirty words in my patient visits or in my courses, but it's like, it's life. I mean, you should see my patient, like, not going to show you, but patient portal messages are like pictures of poop of their toilets. Like, I have some patients take me on a Zoom visit on their phone and take the phone to the bathroom. Yeah. And I'm like,
does this totally look weird?
Fine. Like, I don't get grossed out. ER background over here.
Yeah, totally.
So,
that's so
I think
funny.
it makes it a little bit easier to have that relationship with the provider instead of like, oh my gosh, like, you don't look at my poop. Or,
like everything's fine. I'm doing all the things you told me to do.
Yeah. I can't talk about sex with my provider.
Yeah. Your course that's coming out, is that on your website? Is that how they would find that?
It is, yeah.
Yeah, we will link her website and social media pages and all that stuff with the podcast and on YouTube as well. But you can always find it on Remedy website.
remedyfunctionalmedicine.com.
Yes. Okay.
Or remedyfunmed.com. Either way, same
You'll
thing.
Find it.
You'll find it.
It'll get you there. Nice. Thank you so much for having us today. Is there any last like parting words or gifts of wisdom that you want to share with the group?
I would say if a majority of your clientele are women, I would say you are not crazy.
Thank you.
It's likely your hormones and or gut, and there is something to do about it. Just advocate for yourself. Even if you don't have the financial means to work with someone like me, there's so much free information out there, and you can get to the root cause.
Yeah.
Yeah.
Well, and sometimes too, like I do think that this is one of those things that like find the financial means if you can, because it's really important to really get to the root of it. Like just a small sidebar story. The first time I met Stacy, I had made a comment in passing that I'm allergic to vitamin B. And she's like, who told you that? And I was like, a doctor, kind of, in the ER. What do you mean? I was having an allergic reaction. They're like, oh, it's probably vitamin B. And she was like, yeah, no, we should have a conversation about that. So it's just that kind of stuff, like finding the time and the financial means to like at least meet with you a few times to get like the knowledge and like the information to like be in the right direction.
Yeah. And I totally get it. Like when I first went into my own journey of health, I know we're running out of time, but I was looking at prices and I'm like, oh my gosh, why is it so expensive?
Yeah.
But the amount of time that goes in behind the scenes is crazy. But even me as a provider, I pay out of pocket to see other providers because we also need our own providers, because you just get more done in 3 or 4 visits than you probably get done over the course of 5 years with your PCP or OB-GYN. I mean, the sticker shock may be there, but the benefits and advantages of what you can get done and address are huge.
Yeah. And I think there's a little bit of sticker shock, but to be honest, I feel like you're priced really fair. And especially
I try to be accessible.
Yeah. I know
get
people,
it. I get it.
Well, but like I know people that have car payments larger than what you charge for a consultation. So like that's what I'm saying. You can find the financial means for a certain amount of time to make sure that your gut health and your hormones and everything are where they should be and need to be. And so you don't feel crazy.
Yeah. So. And just don't end up in the ER waiting in a lobby for 12 hours or in a hallway with no privacy.
Oh my gosh. Yeah, for sure.
Because I have stories. But I don't want you sitting in a chair in the hallway for 2 days waiting for a hospital bed. It's gosh.
That sounds terrible.
Yes.
Oh my goodness. Well, thank you so much. I really appreciate you, and I appreciate your expertise and your time. Cheers.
Cheers.
And thank you everyone for listening and tuning in. I can't wait to see you next time. Cheers.
Bye.